Hi, good afternoon. My name is Lakeidra Chavis. I'm a reporter with the Marshall Project. It covers criminal justice all across the country. And this is the third part of today's symposium talking about progress towards peace and solutions to gun violence here in Chicago. Our guests today are Tamar, Manasseh, Eddie Bocanegra, and Dr. David Ansell with Rush University. So we're just going to get started. So my first question for the panel is, gun violence in some ways is sort of a catch-all term to talk about many different types of public health issues that are happening all at once across the city. And so I just wanted to hear from the panelists, when we talk about gun violence in Chicago, what issues are we really discussing? Eddie, do you want to start?
Sure. Well, good afternoon, everybody. This is a great space. It's almost as nice as U of C, so I just want to, point that out there. This is a beautiful space, in all honesty, and I just love people's commitment to really just better understand these issues around gun violence. And what an amazing group of panelists you had prior as well. So, again, thank you for the space. I guess the question that was just lifted, it's to me, it's one is a very complex one that really deserves a lot of time and attention. But in a quick summary, here's what I would just simply say. When I think about gun violence, I think about how it's not necessarily the issue, right, of much of the conditions that we're grappling with right now, which always stem to about equities and racism. And that was clear in the last panelist as well. And so I think about the people who are impacted by this issue. How do they really truly see themselves, and how do people see them? And at the end of the day, I think about, as someone who tries to practice my faith as much as possible through the work that I do, that I think it's just my job to find ways to restore people's dignity. And it's unfortunate that so many of the people that we're talking about, not only are they often victims, but in many cases they're also, the perpetrator. And I think about just like the generations of disinvestment in many of the communities that we work with here, particularly here in Chicago, but the same could be said across the United States, that one, we know that violence is very concentrated in specific, cities, specific areas of these cities. And I often grapple with this thought, this past year and a half as it relates to COVID, as a nation, we really came together, perhaps they've done a better job at that, but we came together to tackle this issue. And I wonder, why is it that we haven't been able to come together to really address the issue of gun violence? Like, do we see it as a public health? I mean, I was just with the president a few months ago in the Rose Garden, where for the first time, at least in my life, I've heard any president really make a bold statement to say how gun violence is an epidemic, and we should be embarrassed as Americans, right, to not be able to tackle this like a public health issue. And so, again, there's a lot that I could say around that, but I want to give some opportunity for the panelists to also just jump in there.
David, what are your thoughts?
Well, how could I disagree with Eddie on anything? Which I won't. But I think I'm a physician, and I've practiced in Chicago for many, many years, all on the west side of Chicago. And the framing of our work has to be understanding first the root causes of the root causes, and understanding them in an intersectional way, of which gun violence, any kind of violence beyond gun violence, because it's not the only kind of violence, is part of a greater fabric. And so if you look at any neighborhood in Chicago, there are 5, particularly in the west and the south sides of the city, there are 5 causes of premature mortality. Now remember, the life expectancy gap in Chicago between black and white people prior to the pandemic was 9 years, the greatest in the United States, which, think about it, if we were just average, fewer people would die. So it's within our strength and realm and capabilities to address it. But those 5 causes of premature mortality in every neighborhood are cardiometabolic disease, hypertension, diabetes, stroke, vascular disease, those complications, number one, followed by other chronic diseases. So if you have cardiometabolic disease and cancer is about half the life expectancy gap, that 9-year gap in any neighborhood, followed by, depending on the neighborhood, infant mortality, maternal infant mortality, gun violence, opioid overdose. 5 causes, all interconnected. So I talked in the beginning about the root causes of the root causes. So, structural racism, which I know has been discussed a lot and needs to be continued to be discussed, is a critical historic and present-day danger to health. It's an affliction, and the affliction kills people in many, many different ways, with those 5 being the top 5 most common ways. So you can't talk about gun violence without talking about cardiovascular disease and without talking about structural violence as a form of oppression or affliction. But when you get right down to it and you look at macro level, what we have to do is we have to understand that in the neighborhoods we're talking about between 1970 and 2010, not to say that things were perfect in 1970, they weren't, capital has been extracted out of these neighborhoods. So the West, the Black West Side, the Latinx West Side, the Black South Side of the city has lost income between 20% and about 150% of the income relative to 1970 terms, whereas the white North Side has gained about 20% to 250%. So there's been extraction of capital. What the economists tell us about disease and mortality is the following, that if you're in the top 5% of income in the nation, you live a very nice life no matter where you live. When you get down about median income, around $55,000 for a family of 4, that where you live begins to dictate when you die, whether it be from gun violence, heart disease. So we've got to look at this as the need to make put the money that's been extracted back in to these neighborhoods through whatever collective efforts we have to do. Yes, we need programs and other things in the meantime while we're doing that. But you cannot have the degree of concentrated poverty in these neighborhoods and expect people to thrive from any disease.
Agreed. I used to look at gun violence as like a layer cake. It's not one thing. It's something that's made up of a lot of different things. So to make a cake, you need different ingredients. You remove one of those ingredients, you don't necessarily have a cake. You have something, but not a cake. And in Inglewood, on my block on 75th and Stewart, I've sat there literally every day for the past 6 years. My job is to understand what is going on the street level. So if you remove schools, if we're in a food desert, if there is access to all kinds of drugs and guns, what do you think you're going to get? You're going to get gun violence. I just in July, I just became a rabbi. And this was my first Yom Kippur as a rabbi. And this year, all summer, we've been having different people come in, different groups, even David's Hospital come in and give vaccinations on our block, because we really need everybody to be vaccinated so we can beat this thing. And basically, we're asking people who are never considered part of the herd to help us achieve this herd immunity, right? And so they're not doing it, not interested. One kid told me, I'm not gonna get shot on my way going to get a shot. And these are the things that we don't think about. And right now, COVID is the conversation that we're having. It is the major issue. It is what Americans are tackling. It is. It's not just a pandemic, it's everything. But there's still this epidemic that exists within a pandemic, and it's being ignored now. Because I hate to say it like this, but honestly, this is kind of like, one of the best things that happened to Chicago. They don't have to talk about gun violence right now. They just have to talk about getting people vaccinated. I went to 10 funerals over the course of the summer. All of them were for people under the age of 50. Not one of them was from COVID, not one. So if I'm asking you to care about COVID, but nobody's caring about gun violence anymore, why would you care about COVID? Why would you care about getting vaccinated? That is not your dog, not your race. So literally, this Yom Kippur, we lit 800 candles for every life that was taken from gun violence from last Yom Kippur to this Yom Kippur. Because we have to pay attention to it. It has to stay a part of the conversation. It has to stay at the top of people's minds, not at the back. Because it's everywhere. It's starting to happen everywhere. It's not just in Inglewood. It's not just in Lawndale. It's not just in Roseland. It's everywhere now. So this has to be something that we continuously talk about, and it stays an important part of the conversation. And people who are the ones who are most likely to be the victims of this, they have to know that we still care, that we're still trying to work on a cure for what ails them. Even though it looks like we're not, we are. That still has to be a major part of the conversation.
Thank you for sharing that, and I just want to say I'm sorry that you've experienced so much loss, especially this past summer. So thank you for sharing those experiences. And before we dive too much deeper into this, can you share what your organization, MASK, does in Chicago and kind of how it started?
I think MASK was just a response of a helicopter mom being too afraid to let her kids just go out into the world, into Chicago, where, there are a lot of parents who pray and every day. They pray for their kids and, they pray for their safety and they still die. So what's the difference between me and them? So I had to understand what was going on. So I had to kind of see up close. And so the idea was, if I knew where violence was definitely going to occur, and if there were mothers there, if there were people there, if there were eyes on the street there, would that interrupt the cycle of violence? And it did. So we went to a corner where a mom was murdered 3 days prior to us showing up for the first time. And I mean, you aren't going there to necessarily, tell kids, don't do this, don't do that. No, you just have to be seen. Because the idea is, if people are being watched, when people are being watched, they tend to behave differently, especially teenagers and young adults. They just do. I mean, it's like momming 101. You just know that, right? But we went there where this mother was murdered, and we knew that if the cycle of violence was going to continue, it would come through that particular corner. And so the idea for me is, I don't believe that any kid is necessarily born bad. And I don't believe any kid would just purposely shoot somebody's mom or 10 moms at one time. I just don't believe that. And I had to believe this will change their behavior. If we're here, nobody gets shot. And I mean, that literally held for all these years. It's never happened. No one's ever been shot when we were there. And so the idea is, it's to watch. It's to keep an eye out. It's to be present in a neighborhood. It's not peeking through your blinds and, being the neighborhood watch. It's letting people know, I'm here. I see you. I see you seeing me. I want you to know that I'm here. And I want you to know that if you do anything wrong, I'm definitely going to tell that you did it. So chances are these things don't happen. And it changes the way, not just the residents in the community behave, changes the way that the police treat the people in the community. Because sometimes the idea of a neighborhood watch or a community policing strategy, community policing groups are there to police the police too. And so things change. You get to see more clearly what the real issues are and how they can be fixed if they are to be fixed. There are things that are supposed to be fixed. I had a conversation with CPD last summer, and I explained to them, there's going to be violence. There's going to be a shooting at this funeral. It's going to be terrible. You need to put people out there. You definitely need to have a lot of cops, a lot of high police presence. They had no one, 15 people got shot, and they said they didn't get a tip. And they did. So if you're telling the community to say something, and if I'm sitting here in this room talking to all of you, I would like to think I'm a credible member of the community, right? So if I go and tell the police something, I really would think that perhaps they would believe what I have to say, but they didn't. So is it really about that? Do you really want to catch the bad guys? Do you really want to do that? I would have never known that had I not started off on the block doing what I do. So it's a way to really dig a lot deeper and see what's going on really on a much deeper level than, I would if I had an office that I sit in every day.
Eddie, can you talk about the work that your organization, READI Chicago, does to try to address some of the issues around gun violence in Chicago?
Sure. So I work for Heartland Alliance, and the program that I direct is called READI Chicago, which is Rapid Employment Developing Initiative. I would say that when I was at the YMCA, fundamentally one of the core reasons why I came, well, there was really three. One, good leadership. Two was the fact that I was able to be a part of a randomized controlled trial study to be able to prove what I already knew was to be true. But I guess I needed that kind of science to validate specific experiences. But the third one was because of the size of Heart Alliance and the various companies that exist within the alliance. So mental health, housing, a lot of our work internationally, working with refugees is another example. But all those things is what I always knew were needed to really create a viable pathway for individuals who are at high risk of gun involvement, either victimization or perpetration. So in essence, READI Chicago was birthed out of 2016 when we saw a spike of violence here in Chicago with 750 homicides, nearly 4,000 shootings. And right the following year, we partnered with the University of Chicago's crime lab to really test something that hasn't been done before, but taking some of the best practices or what we knew seems to be working to reduce gun violence, like employment, CBT with young people, CBT with those who are in the corrections, and really infusing this. And so in essence, what the program really is that we target individuals who are the highest risk of gun involvement. We saturate them with resources, and those resources start off with a job, right there and then. Secondly, with CBT or CBI, which is kind of behavioral therapy or kind of behavioral intervention. And then finally is really supporting other needs that the individual has. Often is housing, often is individual mental health or substance abuse issues, right? So that's in essence what I lead. And I'll just conclude my comment by saying that what we're seeing right now, and it's extremely promising through this RCT, and again, too often when I hear about people talking about solutions and there's not enough evidence, I just think it's just the poor excuses. What I would say is that what we're seeing through this randomized controlled trial study is that we're seeing about 80% reduction of those who are in the treatment group, right? So just comparing apples to apples, those who are in the treatment group less likely arrested for murder or attempt murder compared to those in the control group. Think about that, 80%. And again, I'm not saying this to gloat, but there's a reason why our Attorney General of the United States came 2 months to visit us. Why I met with the president shortly, after being with him at the Rose Garden, is because of the kind of evidence that we're able to demonstrate right now. More importantly, what we really are articulating to our audience is that fundamentally, these individuals want more in life. And they should not be judged, right, based on previous mistakes or because of the conditions they're living in. They didn't choose to be born to the zip code they were born to, let alone to the parents they were born to. And you just heard, both from David and from other panelists a little while ago, that too often, right, those factors really determine your outcomes. So, for almost 5 years doing this work with READI, we are seeing about a 30% reduction of also victimization. That number seems to be unstable, to be quite honest, because the truth is no matter how much we see improvements with participants, the conditions in which they live haven't really changed. And they're not changing fast enough for their own change.
Do you want to add anything to that?
Well, just, what Eddie was saying, yeah, and I think what Eddie and Tamar were saying, that the conditions under which people work, live, and play determine how long you get to live. And that's when I talked about the root cause of the root cause. We have to relieve suffering. And just a little bit about Rush. I actually was the chief medical officer at Rush, having worked on the West Side for 30 plus years, to come in and improve quality and safety. And Rush is a very high quality place. But I couldn't help but think, on the one hand, inside the walls, you could be top in quality, and outside the doors, people are literally dying every day of the diseases for which we were capable of treating. And that if we didn't get to those root causes, and that led me, that's how I met Eddie. That's how I met Eddie, or how we showed up in Englewood to get vaccinations. So as an organization, to take on this bigger problem of justice and equity, and the problems of racism and what I would not poverty. Poverty is a state. Economic deprivation is the act that keeps people in poverty. That how do we, as a big organization, I would even say historically white organization, partner with the community on the things that they need systematically over the long term to really make a difference. And what that means is, how do we hire locally, go into the community, hire, someone in Eddie's program, READI, and give them a job in healthcare, but not just a job, a career. And we worked and that means we've got to take our hiring out to the west side and out to the south side. How do we invest in local businesses and those other types of, sort of root causes? How do we invest in infrastructure in the neighborhood? But I think the most important thing, Tamar, what you said about showing up. So I always think about when I come into a space like this. So we're having a beautiful event today here on the lakefront. What would it mean if your professor said, we're going to have this event on the west side, and we get in buses, drive to the west side, and we buy lunch, and you walk around the neighborhood on the west side. If we don't show up in these neighborhoods, see, if we don't show up, how are we going to spend a dime in these neighborhoods? We've got to think about a restructuring of our day-to-day business. It's not okay only to show up in spaces like this. So we came in, but imagine if Northwestern Law said we're going to hold events for the next year on the west and the south side of the city, and we're going to spend money there. Because that's the way we're going to get sort of the flywheel of improvement better. We have to show up in the moment. I do want to say the showing up piece becomes, particularly as a physician or as an organization. I got a call today, and it's from Ms. Tillman, who's the principal of Melody K through 8 in Garfield Park. And I've known her. She's a dynamo, really. And it's an amazing K through 8 because it's ranked level 1 in the Chicago system, which means it's a top K through 8 school. Her call was, she says, I'm at my wit's end. I don't know what to do. I had your phone number. I said, what do you need? She said, one of our children, and maybe a few of them, are addicts. They're addicted, and we need to get them help. And then she said, I drove into school today. They're selling heroin out on the street, and we don't have a fence around our school. And I'm thinking, I took my grandson who went to pick him up at school in New York about a week ago, 5 years old, kindergarten. And there's a big fence around the school that's locked, and then you let the parents in. And for the sake of a fence around a school to keep these kids safe. And so today I've been organizing when we're going to take care of this child, because we got to show up for each other. But we're going to figure out how to get a fence to that school and to keep the kids safe. And that's kind of what we have to do. We have to create these interconnections between our organization. So I always ask, what can we do today, say at Rush, to dismantle these systems of oppression like structural racism and economic deprivation? And then how do we show up in a more meaningful way? We're going to bring a drug education program into the school. We're going to figure out how to do the fence. We're going to take care of this child. But what if we all did this through our organizations with a greater degree of attention? So when Tamar's on the corner, we're sitting up and sitting down with her. So I think that's kind of our collective work. And I guess it's enough. Let's stop talking about it, for God's sakes, and let's start really substituting talk with action. So that's kind of my take on all of this. Maybe because I'm an old man by now, and the clock is ticking on this. But I do think last thing is, these are human-made problems. These were problems made by man. I don't say women, but because it's mostly men. But it's a human-made problem, worse in Chicago. And if we could just get to average or better than average, we're going to see great successes. And it's just a matter of our intentionality around solutions.
One follow-up question that I had, and Eddie, you touched on this a bit, but I'm curious, when these solutions and being out in the community, how do you know it's working? And what are you using to assess, whether these efforts are making a difference in gun violence? You had mentioned that y'all had seen a reduction in shootings?
We built a school because the neighborhood schools, all the high schools were shut down, and we had a problem with so many kids who were coming from the elementary schools in that neighborhood not having a high school to go to because those schools were closed, that they just weren't going to school at all. So it's not that they dropped out, they just never actually went to high school. And so it was kind of like, well, if the kids are out, then we're out. If the kids aren't in school, we're outside. We can't be outside on a corner in Chicago in the middle of the winter unless you're just like glutton for punishment, something like that, just crazy. But we decided that we were gonna build, we needed an indoor space. We couldn't just sit on the corner. And so we actually built a community center out of shipping containers. And we figured if the one-room schoolhouse method worked, I mean, for some of the greatest Black thinkers that, I mean, we've ever seen, if they went to school in one-room schoolhouses in the South, why wouldn't that work again here? Why couldn't we do it again here? So we actually were gonna do trades there. But then the pandemic happened. And then now we have all of these little kids who aren't going to school. And we have all these parents being faced with having the choice of losing your job or leaving your 9-year-old at home to take care of your 4-year-old or your 6-year-old. So we told them all, just bring them to us. So we had all these kids every day. But what we were able to do every day was kind of assess where they are in CPS, where they were in CPS. If they were where they were supposed to be, if they were lagging behind, we were able to work on that. So we did not just remote learning with them every day. We had a class about gun safety and gun education because we need to talk about guns because everybody around here, every kid here knows someone who's been killed with a gun, so let's talk about that. And that was what we wanted to see in the local CPS elementary school. We were even willing to pay for the pilot, but that just wasn't something that they could see themselves teaching. But for the longest, I've been saying gun violence is not something you're necessarily going to legislate your way out of. You have to educate yourself out of it. And so we talked a lot about that. We learned a lot about empathy, why you wouldn't want to shoot somebody, what your family felt like when they were going through that. We talked about drugs. We talked about different kinds of drugs, who does drugs, why they do drugs, what happens to your body. We had health professionals come and talk to the kids about these things. And I learned that that's kind of where you have to get in at. You do have to get in with the little kids. You do. I mean, there's a lot that can be done with teenagers and young adults, but if you really want to turn this around, you have to start now. You could teach driver's ed, if you could teach sex education, you have to start talking about guns, considering there are so many more of them in homes, so many more of them on the street. You have to actually make it a choice. Kids have to make a conscious choice. I just don't want a gun. You have to literally turn kids against guns. And so that's really what we've been working on, but it's an educational thing. It's an everyday, it's a sustained effort constantly. It's not something that you do once in a while. This becomes a way of life. Just like violence happens every day, fighting it should happen every day too.
So it sounds like what you're talking about is more of a harm reduction approach. Well, this is how you safely use a gun. This is how you,
absolutely,
properly
that
lock it up.
has to be integrated into the whole process, right?
Eddie, how does your team approach gun use, especially working with people who are most at risk of gun violence in Chicago? How do you approach that type of issue?
Yeah, so I went to grad school so I could just learn to articulate, right, and be able to convey a message to an audience that typically are disconnected from the communities that I serve. So I served over 14 years in prison, from the ages of 18 to 32. And that experience in my life, that journey, right, taught me quite a bit about the people that I was incarcerated, not to mention almost 2 years spending in segregation, off and on, 3 months, 6 months, 9 months. And I will never forget, I was actually at a foundation, panel conversation. It was a professor, I think he might have been in Yale, who wrote a book called Gang Leader for a Day. And I read that book in prison, and I said, this guy's a liar. But it's a difference of opinion there, given the fact that I spent time in those projects. My point here is this, that there was 3 panelists, including myself, and they were talking about their perspective of the work, right? From an academic point of view. And here I am, just started my first year in grad school, and I built, the strength to really start my conversation by saying my perspective is informed by the fact that I was in a gang, that I witnessed, a lot of domestic violence in my house, community violence, school violence, but also as someone who created many programs and who's leading multiple efforts as well. And so I guess for me, as I mentioned earlier, when I was at the YMCA managing a lot of our youth work, I would grapple with stats in the sense that, less than 20%, about 10% to be more accurate, but, less than 20% of the victims and perpetrators of gun violence are under the ages of 17. That means that 80% plus are those that are 18 years and older, with about 55%, give or take 2 points, between the ages of 18 and 29. And I would ask myself, why is it that we spend so much resources, right? The city, the state is funding a lot of youth services. Not to say that we shouldn't. We should. We need that. It should be part of the comprehensive strategy. But there's a population that are left out. And why is it that people decide? Like, who decides who's worthy of investment? And so Dr. Ansell, who knows better than I do, but my father-in-law, who's also his colleague, who's a surgeon at Rush, our dinner conversations typically, we talk about a lot of different things, including classic cars and my 7 kids. But one of the things that we talk about is about cancer. I think about the people that I serve with READI Chicago as individuals who have a stage 3 colon cancer. That means they have about a 60% chance of beating it if they get the right treatment. That also means that the cost to support somebody with a stage 3 cancer, it's much, much, much more higher than somebody who has a stage 1. Or we're trying to do preventative work. Again, all of that is important, and all of that should be part of the strategy. But I've committed my life, right, to really advocate for a population that's been grossly overlooked, that has been marginalized within the marginalized. And so here's what I'll say. I'm going to give you a quick snapshot of who it is that I serve. On average, the men in READI Chicago have 17 to 18 arrests. On average, 60% of them have done prison time. 80% of them have 10th grade level of education, but they're reading at a 5th and 6th grade level. So as David pointed out earlier, imagine what does that look like in terms of opportunities for them. The other thing that I would say is that 83% of them have experienced victimization. They've been shot, stabbed, or assaulted. This is all according to police and hospital data. We believe that number is actually higher because many of our guys don't check in the hospital sometimes when they've been assaulted. We also, at 92% of the people that we serve have lost a family member to violence, 92%. So the folks that we work with, like we use what we call predictive analytics as one form to identify high-risk individuals. And again, it's really important because, I was in a meeting last year with NIJ, the National Institute for Justice. They invited me. I'm not sure they regret it or not, but I was invited for a full day, kind of think tank. There was eight researchers that I cited when I was in grad school, who I was like, and I still do think highly of them. But what I learned the first hour of that meeting when the people were talking about their research, I realized that those individuals, right, those researchers only have access to local nonprofits to who they have access to. And most of the time, local nonprofits have an arm's distance access to individuals. Who READI Chicago serves is what we consider or we call non-social service seekers. They're the people that are not coming to your institutions, no matter if you invite them. They're the people that don't care about you. They're the people that have been disconnected from the school system, who don't trust institutions, right? So it takes a very different approach to be able to serve that population and the interventions that are required. And so one of the things that I would say that I get a lot of slang for is that I also believe in quality. I believe that the people that we serve deserve the best. If your child was sick, you will come to Northwestern. You will come to a UFC. You will come to a Rush. Most of the folks that we work with, no offense, they go to clinics, if lucky, Loretto Hospital. Sometimes nowhere. So why is that? And I think I've taken the mission to help elevate the field of gun violence because it's also a very stagnant field. So when I hear the kid talk about like data and research and so on, like I am trying my best to convey a story, a narrative, that the people that we serve are worth investing, but it requires a lot more work. And so all that to simply say that if we're serious about reducing gun violence, we do need a comprehensive approach, but we also need more resources to focus on those who are driving the gun violence, because it's a very few number of people who are doing that in our city and across other cities, and they're in concentrated communities.
David, have you had discussions with other physicians about teaching, proper, safety when possessing a gun, or how to properly store a gun as an approach, a harm reduction approach?
Yes, and of course, that's got to be part of the discussion when people come into the offices. Talk, as Tamar says, we've got to talk about guns and gun violence, and that's certainly part of curriculum in medical school and such. But I also think, and I'm thinking about, I don't know if you're all law students or undergrads and such. There are ways to plug in a very meaningful way. The other place where I think, from a medical perspective, we begin is understanding trauma, and that the idea that overlaying all of these causes of mortality that we've talked about, including violence, is trauma, oftentimes intergenerational, passed down, and that this psychological well-being is such a critical part of the work that we're doing, and how do we make sure people are having the kind of services that they need. So I think that's a toggle between, and obviously there's another fact around medical services. So in the United States, surveys of patients, particularly Black and Latinx patients, that 1 out of 3 have experienced discrimination or perceived racism in the last year, and it's across the board. And so health systems are not the ideal place to be treating the problem. Those certainly teaching it and asking those questions of our patients is critical. So part of our work is partnering with organizations and then figuring out how do we serve the needs of those organizations. Dr. Paul Farmer, who's really a tremendous thinker and leader on this, talks about this idea of accompaniment, and and what that means is very different than the way we actually think about how we practice law or medicine. Accompaniment means I travel with you on your journey as a leader, as a person, as a community, and I have to live the life that you're living alongside of you, and I have to then address the needs that I can as you raise them. And I'm only free of that obligation when you say that I am. And so, from a medical perspective, we sometimes get it completely upside down and wrong. And so this idea of accompaniment, like if Tamar says, show up, will you show up and do vaccine, but also help us get these kids physicals, we're going to figure out how to do that. And then we're going to do it as long as she says we need to do the same with the work that Eddie does. I can tell you, as an institution, we began to say, how do you intentionally hire locally? And then how do you hire what are known as disconnected youth? This group between, say, 18 and 29-year-olds who've never been part of any system. How do we help them move into not just jobs, but careers? So we're working on the West Side with the Ma'afa Redemption Program that Eddie knows well. And these are people who spend a year in learning skills, but learning about Black culture, learning about that the trauma that they're experiencing is connected into a historical trauma that's still going on, but also this idea of giving them hope that there is something at the end of this. You can actually see a future and in a job and career. And we put hiring kiosks in the neighborhoods, in organizations where they've never been. What do you want to apply for a job at Rush? And then how do we navigate those people into those jobs? But, Eddie talked about CBT, cognitive behavioral therapy. The idea that we shouldn't treat this like we're treating cancer at Northwestern, or heart disease at Rush, that if we're going to think of these things as these systemic problems, it's got to be the highest quality care, and the treatment has to be all-inclusive. It has to be behavioral health. It has to be addressing people's physical health problems, oftentimes neglected. It's got to be about safety. There's all kinds of safety things besides gun safety, but it also has to be is how do we now get you thinking ahead to a job and a career that allows you to get to some degree of wealth creation, allows you to cross over that amount of wealth in a family that brings hope. And I think that's the nature of our work. It's complicated, but it's doable. But it's doable work. And I find the only way to do it is to just say yes. And then as students, as you're thinking about how to do this, there's like 100 ways that you could plug into this work right now, have a meaningful impact, and make a big change. So I just wanted to put that out to the audience as well. This is work that we've all learned to do. I didn't go to school to learn this. Certainly you didn't. You learned it, and Tamar, I don't know what's your background, but we actually learned it because it's necessary, and it's very rewarding because we have seen the outcomes. And we have seen the outcomes, and they're sometimes measured in small numbers. One street, less shootings. The data that Eddie said, a lot of times we have to prove things to people to get them to invest in what we know is true. See, no one said, let's look at what the damage is done when we extract capital out of neighborhoods and have people not have jobs or feel like they have hope in their lives. No one measured that. But now if you say, well, okay, we're going to need to put a new business here, we need to put jobs in this community, it requires data to measure. But nonetheless, we do it because we know that we can prove the point.
And just to follow up on some of what you're saying, which is essentially people coming together from different parts of the city, different organizations working together to address this issue, what role do you think the criminal legal system plays in helping to address this problem? Tamar, do you want to start?
I think it aggravates it. I've yet to see the Chicago police help with anything that goes on in that neighborhood. And it is just one corner, but I'm strategically placed on that corner for a reason. Before people get to these different organizations to be helped, you have to help people get bus fare. You have the person who doesn't have anywhere to wash their clothes and they need to wash their clothes to go to a job interview. Somebody who needs bus fare, somebody who's sleeping in a hallway and you need to help them get somewhere to sleep that night so they can get up in the morning and take a shower to even get somewhere to get help. It has to be, I am there on that corner. In every city where there's a chapter of Mass, it is always on a corner because it has to be the most easily accessible thing in the world. It has to be so simple, you don't have to call anybody, you don't have to do any of that. You just walk in and say, hey, you know what? I got a job interview tomorrow, I need bus fare. And I might need $3 to go to the laundromat and wash my clothes. Okay, it needs to be that simple because that's how, that's where it starts. It starts really, really at the most basic things that people need to get to the levels that they need to get to, right? But I honestly, I don't believe, when I got the email, they had a sample question in the email about Chicago being safer. What can we do to make Chicago safer? Or how law enforcement plays a role in this. I think that's all, the way that I would answer that question, I don't think Chicago has ever been safe for Black people, like ever. I don't ever remember a time, my mother grew up here and I can remember her talking about a friend being shot by a carload full of white kids in 1956. They shot a 12-year-old. They went home, he was buried. I had an uncle who was shot by the police when he was 14 in 1963. So, and then if this year was the worst year the most violent year we've seen since 1996, obviously that wasn't a very safe year either. So when are we ever really safe here? And when exactly does law enforcement ever fix anything or help anything? When has that ever happened? So for me, it's kind of like, it's always, I always have to go around them. And it is that intervention that happens in the community. It's important for me to know who's beefing with who. So perhaps I can have a conversation, or I can have somebody intervene before it does lead to bloodshed, because the police never fix it. They will aggravate the situation. If I go talk to the police and we both know the exact same thing, how is it that you've done nothing about this and I'm trying to figure out how to fix it?
And what do you mean when you say they aggravate the situation? Like, can you walk us through what that might look like?
We know that music and art plays a large role in a lot of the violence that happens now. So if you hear the same music that I hear, and we see the same videos, and we know where all of the same violence is coming from, but I'm not gonna lock you up, I'm gonna leave you out just long enough to go and shoot such and such, because I know they made a song about killing your brother, and we all heard it, but we're not gonna act on that at all. We're just gonna let it keep going and keep going and keep going. What people see on the news, they see, you might see someone is murdered today. Well, that murder, that is the end of one story and the beginning of another. That murderer, this murder, is somebody who killed somebody 6 months ago. And you saw it just like I did. You knew who did it 6 months ago. That murder didn't have to happen. You could have stopped it. You had all of the same intel that I had, and you did nothing about it, and you still let it happen.
Eddie, what are your thoughts on this? What role do you see, at least in the context of police, playing in addressing gun violence?
So I come from a family that heavily has supported, and they are in the military. And so there's a part of me that really empathizes with them and some of my other family members who are in law enforcement. And here's what I've learned. David talked about trauma, right? And there's some friends that I've had as kids, they ended up becoming police officers. They ended up finding ways to kind of get their arrest records removed, and they became cops, which is amazing. But I learned that after about 3 or 4 years, they were not the same people. And I think that, I think about why is that, and what's happening to many of the law enforcement, and are we also asking too much of them? Should they be solving, homicides and shootings, or at least trying to prevent that, or should they be doing other things? And I won't go into what the studies and the data is telling us about that, but I think about the work that we do with READI as a way to potentially complement some of what they're doing. Or maybe it's an alternative to policing, however you want to call it. I think of it more as a complementing, because, to Tamara's point, if the officers know who are also those who are more likely to get shot, right? I wish they would just refer them to us and let our outreach team connect with them. But that's not always what happens. I mean, that does happen with the Department of Corrections in the jail. We have that kind of rapport with that level of law enforcement, but not with the police department here in Chicago. The other thing that I heard one of the other panelists talk about, the CPD has about $1.7 billion, right? Then I asked myself, wow, if gun violence is really a priority, if public safety is a priority for you, and education systems is a priority, all you gotta do is look at somebody's budget. That's gonna tell you where their priorities really lay. That's a fact.
Tamar, do you have any response?
No, I'm just thinking, complimenting the police. I don't even understand. What are they supposed to do? One thing they're supposed to do is written on the car, serve and protect. Neither happens in Inglewood. Neither of those things happen. And we personally, on that corner, had to identify, last year we identified 10 kids who were most likely to kill or be killed, and we sent them to trade school. And I think there were actually some students from READI that were there with them. And we don't get any funding from the state, no government funding whatsoever. So this is all just out of our funds, right? But the idea was, if we know that these kids are the ones who are going to be the shooters or be shot, honestly, it was just about time management to rescue them, honestly. It was about you just have less time to be murdered, less time to murder. The police were incensed by that, outraged, because basically we've taken the ones that you pretty much everything is pinned on them. They're not doing that anymore. Now they're doing something different. And it's not about them. They're never going to refer kids to organizations to say, hey, here, you know what? I need you to help them. That's not what they do. You have to go out there and find those kids yourself. Because the police is never going to say, you know what, I'm not going to lock you up, especially not with black males. I'm not going to lock you up. You know, I'm going to take you to this program, and I'm going to get you involved, and I'm going to help you turn your life around, said no cop in the 6th district ever. So, I mean, this is just it. I mean, maybe different organizations see things differently from the way we see it because we are literally on the ground as one can get. So, but I just don't see, I feel like there's a war between CPD and the mayor and the state's attorney, and the citizens of the city are just a casualty in that. We're all just casualties, that's it.
Do any of you
Can I
feel-
add one thing to that too?
Yeah.
So that's the first part that I wanted to share. But here's the thing, right? Earlier today, they talked about the mayor's office going after gang members, right? True story. I get pulled over last year for speeding, state police. I get pulled over. I got my 6 kids, and my wife was pregnant at the time. And it's about 9 o'clock. We're going out to the little town, Galena. Now, I get pulled over. I was speeding. I was about 17 miles over the speed limit. I hand over my ID. About 30 minutes later, officer shows up to the passenger side, looks at my wife, and the first thing that he says, he's like, I have to ask you this question. And I said, sure. You know, he says, are you still in a gang? And in my mind, I'm like, this clown right here in front of my kids. My kids have no idea about my background. Second thing that I said to myself, I was just talking to the mayor's chief of staff that morning. Also, my wife, who is a professor at UIC, works for the Attorney General here in Illinois, Kwame Raoul. And these thoughts are going through my mind, right? And talk about CBT, Dr. David. CBT had to kick in there for me because I wanted to say something so negative. And I said to myself, he's a young officer. Doesn't know any better. So I had to calm down, right? But I asked myself this question. If the mayor, right, passes this ordinance or whatever the case is, when people gets pulled over and their records come up, right, 10%, according to the stats that was said earlier, right, people are affiliated with gangs according to the database, right? So whatever good you've done in your life, a year, 6 months, 2, 5, 10 years ago, it doesn't mean nothing. So my question is, okay, if we're going to play that game, right, then why is it so hard for us as citizens, taxpayers, right, to say, okay, let's use that same policy on the police department, that every time they assault somebody and we sue them, we don't use taxpayers' money. We're paying over $100 million a year on that, by the way, of your money. And we should maybe personally hit the officer's pocket. But the reason why that doesn't happen is because of the union. So when I think about how do we unpack and how do we think about the systemic issues that is causing where we're at right now, are also those institutions, right, that are protecting each other. So I think it's also important for us to just like dive in deeper in that so that we could really think about accountability as it relates to that as well. And that to me is like as someone who's been assaulted by police, right, I still believe that we do need police officers in our communities. In fact, our participants in READI Chicago would say, hey, listen, man, we need police officers, you know, but what we don't need is to get our rights violated. This is them saying that, right? At the same time, like we also need to invest in the people who are doing this work, like what Tamar is doing, what David is doing, right? Other people that you heard today. In our public defender's office, by the way, that is grossly underinvested.
So I was stopped by the police for weaving lanes. and stopped, and then 5 minutes later, he said, "You know you were weaving lanes?" I said, "No, I didn't know." I said, "Well, thank you, sir. Just get a warning." I want to say that is that every system is designed to give the results that you actually get. That's quality and safety, right? If your system is designed in a certain way, you're going to get a certain set of results. Almost $2 billion into the police here in the city. And as Tamar mentioned, the exact same results. That's Einstein said that's insanity, right? And so we have to think about a failed system. So I'm an expert on safety, patient safety and things like that, and systems in that way, but not an expert on police. But I do know from a friend who works in the crime lab on data, here's a fact, that the police get rewarded for stops and, the stop you got, 10 miles over, or your lights off, or something's on, they get a reward system on that, and it's in the neighborhood. And then they go relax in another neighborhood. And if they spent time, and now what do they call that when they break into your house because they think you're a drug dealer? Where they say they knock in your doors disproportionately in black and brown neighborhoods versus white neighborhoods. So the terror that occurs at the system that the police have created, a system of terrorism almost. Not to say every police is bad, I don't think they're bad, but it's like a doctor in a bad hospital. Best doctor in a bad hospital is a bad doctor, right? The hospital, I worked at places that were not as good as the place I work now, and you couldn't provide as good care. So if the police were rewarded for deterrence versus stopping, in other words, sit on the corner. Just sit on the corner. Talk to people, get to know people, but they're not. So the system has to be redesigned. Almost $2 billion into it with the results we're getting. It needs a redesign. Now, there's lots of reasons it's this way, but I do think the urgency, I defund the police, which we heard a lot of. So we have to understand that police brutality is a public health crisis. We're talking about homicide as a public health crisis. Policing is a public health crisis. We have to address it like it's a public health crisis, and it needs redesign. So I'm just going to leave you with this analogy. Hospitals are collision shops, basically. You go there when you're sick, they take something out, hope you feel better. Your father-in-law is a tremendous surgeon. That's what he does. And we need collision shops. So we do need the police for a certain set of things. But we're never going to get to health by building more. All the Northwestern, Rush, U of C, you name the hospitals, we have this giant life expectancy gap. So until we get out into the community in a different way, have a different relationship with each other, we're never going to get the outcomes. So that's my take on the police. It's a failed system, and until we are ready to grapple with it, it's not going to get
In 6
better.
years, and I don't live on the block that I'm on. I don't live on 75th and Stewart. I live in Brownsville. In 6 years, we have not, and this corner was designated as a hotspot. In 6 years, we have never called the police for anything that has happened on that corner, not once. We've seen guns, we've seen fights, we've seen some of everything on that corner, and we could always handle it. The community handled that. I believe it's only those situations that the community can't diffuse, then you call the police. Invite them in to come help. Don't just insert yourself into the situation, because chances are your presence here is going to make this situation worse. We see that happen a lot. It just escalates it. Everybody around them gets agitated when the police show up. Everybody just gets amped up, and it turns into something that it never even had to be. Just the presence of the police when there are different scenes, different things going on, just the presence, it turns it into something that is just completely gets blown out of proportion. It wouldn't have happened if the police were there. They wouldn't have showed up.
We're a little over time, but thank you all for sharing your experiences.